If I didn't have the psychologist, I would have been, I wouldn't even like to think about where I would have been. She helped me see past all the bullying things and tried helping me unlock my true potential. Yeah. I'm glad I had the help.
Health professionals and allied health professionals, so we're talking here about psychologists, we're talking about psychiatrists, we're talking about speech pathologists and other professional groups, do need access to information about autism spectrum disorders in general. They also want access to specialised training so that they can really respond to the mental health needs in particular of this group.
It means I got a number of obsessive and compulsive disorders and a number of fear which I'm afraid of. It's almost like a phobia. And that infringes on my effort to get around.
We know that people with Asperger's disorder and high functioning autism do want access to counselling and emotional support. They also want access to supports in their own communities that enable them to make social contacts and develop the social relationships that they really value. We know that they want befriending programs, they want opportunities to join social groups for structured and planned activities in their communities. They want opportunities to meet others who may be similar to them in their community. So one of the really important things is that we move our health and mental health services out into people's actual communities so that they're in a much better position to support them where they need support. It's very difficult for people in this group and for many people with mental health issues to transfer ideas or strategies from a half-hour session in a clinic into their real world. That's particularly so for this group.
If I had one piece of advice for allied health professionals in supporting somebody with high-functioning autism or Asperger's, I think it would be just to take the time to really understand them.
Once I got diagnosed, I did see psychology professionals, and that helped because they gave me solutions to certain scenarios, and they asked that if I, do a mood diary, or so if I feel a certain way, I can write down why and what the solution would be. So it does help.
If health professionals are working with a young person with autism or Asperger's and they're wanting to learn a little bit more about particular strategies that may be helpful, they can access training. So for example, Aspect runs workshops 3 times a year that is specifically around interventions for people with autism, and it's really a lifespan approach. So we cover interventions from early intervention through school-age children, social skills training, behaviour management, into adulthood in terms of managing anxiety and depression. So they can certainly seek out formal professional development like that. They may have a colleague who knows more about autism that they could consult. Again, Aspect offers a more formal approach where we can provide supervision on a one-to-one basis. So if somebody is working with someone with autism and they just want to kind of present that case to somebody and come up with some potential strategies, they certainly can approach us and we can arrange supervision one-on-one, and we're able to offer that on the phone as well. We do some work with regional psychologists who are very isolated, but they're able to get input from us and come up with particular strategies for that particular client that they're seeing.